Since 1994, the International Conference on Population and Development, or ICPD, held in Cairo, gave a remarkable consensus between 179 countries, including Vietnam, that individual human rights, including reproductive health and reproductive rights, is a necessary condition for sustainable development. Respectively, Vietnam has developed the National Strategy on Population and Reproductive Health from 2011 to 2020, driving the completion of the Millennium Development Goals, as well as to ensure the continuous progress of the ICPD principles.
Trong nhiều năm qua, vấn đề chăm sóc sức khỏe bà mẹ và trẻ em đã có những tiến bộ rất đáng được ghi nhận. Đấy là tỷ lệ tử vong các bà mẹ, trẻ em đã giảm rất nhiều. Nhưng bên cạnh đấy thì cái sự giảm như vậy thì chưa được thật đồng đều. Là ở giữa còn có sự chênh lệch giữa khu vực miền núi, vùng sâu, vùng xa cũng như so với ở vùng đồng bằng, vùng thành thị. Chính vì lẽ đấy mà cái nhiệm vụ này cũng phải đặt ra cho các nhà chuyên môn, đặc biệt là các nhà quản lý trong ngành y tế phải có những giải pháp thiết thực hơn, giảm tỷ lệ tử vong của các bà mẹ, phải cố gắng giữ được một cách bền vững trong nhiều năm.
2015 is an important milestone for Vietnam to assess the implementation of the Millennium Development Goals. Besides, 2015 was also the year to end the first phase implementing the targets of National Strategy on Population and Reproductive Health. With Vietnam become a middle-income nation, requires new and creative strategic approaches in the field of reproductive health and family planning.
Ladies and gentlemen, welcome to Sharing Vietnam on VTC10 Net Viet. In our program today, we would like to share with you on the priorities of the sexual and reproductive health system of Vietnam in 2016-2020. Now, Vietnam is a middle-income country. This is a great achievement for Vietnam. However, this also opening up opportunities but challenges for the sexual and reproductive health sector in Vietnam. Let's welcome the representative of UNFPA in Vietnam, Ms. Risu Nakin, and she will share with us on how Vietnam can improve on its sexual and reproductive health system. Thank you so much for joining Sharing Vietnam. What are your comments on the results of the phase before the 2015 of sexual and reproductive health strategies?
Vietnam has a very good primary health network and have almost achieved all the MDGs. This means the country has a very good foundation to progress towards universal health coverage. And this is a huge advantage because it means Vietnam is no longer struggling on the major issue of maternal death or infant mortality. Of course, we have challenges, but Vietnam has made significant progress in the last 20 years. In terms of challenges, still there are many. And one is that in terms of the disparities among the different ethnicities, regions, Vietnam needs to really make sure that no one will be left behind and everyone can enjoy quality reproductive health care services. The second issue that we still face the issue of data, that if you go to the provincial or district level health centers, you may not get the very accurate data, what is really happening. And these data are really important to design the more targeted, more effective services and the policies at the central level. That although many of Vietnamese people can enjoy access to services, the quality still needs to be improved.
We all know that Vietnam has achieved the middle-income country status. However, this also creates challenges for the sexual reproductive health. Can you share more with us on these challenges?
Of course, it is a challenge that many donors are leaving the country and there's a lack of resources. But I think this issue needs to be also considered as opportunities because this means we will have to really come up with innovative ways and also partnership with the private sector to provide better, effective and efficient services.
Among key issues in sexual and reproductive health, what are the top issues that should be the focus in the next phase of 2016-2020?
As I mentioned already, that the first very critical area is addressing disparities and making sure that there is equity in the service provision and also utilization of services. And it is a crucial issue in the SRH agenda. Also, it is really important that we address the needs of the young people. National Target Program has been focusing on the married couples, but still the unmarried young people, adolescents, are not enjoying the benefits of the services as much as they want. Thirdly, we also need to look at the issue of migration. A lot of migrants who are also often young women needs a special support. So that needs to be also looked at. Another issue is that, of course, as I mentioned, data, and the UNFPA is conducting the Adolescent Sexual Reproductive Health Survey this year to make sure that we have a good quality data to provide, to develop a good program for the country in the coming years.
Recently, workshop on priorities after 2015 on reproductive health and family planning was held in Dosan, Haiphong. With the participation of representatives from the Ministry of Health, the General Office for Population, medical universities, Institute for Community Health Development, scientists, international and domestic organizations has raised the experiences, difficulties and challenges from which priorities in the field of population, reproductive health and family planning were selected.
Chúng ta thành công được là nhờ đâu, và những cái khó khăn mà chúng ta phải đối mặt là gì, chúng ta phải nhận dạng được sớm, có như vậy chúng ta mới tìm ra được cái giải pháp.
Besides past achievements, population and reproductive health care services are also faced with many new emerging problems, many difficulties and challenges affecting the implementation of the objectives of Vietnam's national strategy on population and reproductive health, as well as the Millennium Development Goals.
Cái ngân sách càng ngày càng eo hẹp, đặc biệt là trong cái việc cung ứng các cái dịch vụ, phương tiện tránh thai, an ninh phương tiện tránh thai từ nguồn nhà nước là có nhiều thách thức và khó khăn. Và bên cạnh đó thì cái nguồn lực của xã hội cũng chưa được tiếp nhận đầy đủ. Và việc kiểm tra giám sát, việc đảm bảo cho người dân được nhận những cái dịch vụ một cách tốt nhất và chất lượng nhất thì chúng ta vẫn chưa có được cái cơ chế để kiểm tra giám sát cái. Chúng ta thấy là sự chênh lệch mức sinh giữa các vùng miền, nhu cầu càng ngày càng lớn, đặc biệt là các phương tiện tránh thai hiện đại, làm sao để đáp ứng được cái nhu cầu đấy. Công tác dân số kế hoạch gia đình hiện nay cũng đang có thể nói là chưa ổn định và đang từng bước hoàn thiện.
Vietnam is at its golden population. This is a great news for Vietnam. However, what are the things that Vietnam has to take in mind in the strategies of reproductive health and family planning in order to maintain the advantages that the golden population open up for Vietnam, but also lengthen the transition time for the aging population?
It is really a critical point that Vietnam is standing now in terms of taking advantage of a population bonus period. In our recent research, actually we need to really hurry up to take advantage of this period, because if you look at the really intergenerational economy, the transfer of the funding or resources, actually it's not up to 2040 that we have time of this windows opportunity, but it is shorter. So it is an urgent task for all of us to really look at how we can invest in young people, and that will lead to the economic and social growth of this country. And if you look at this issue from the reproductive health perspective, we feel that there is a very urgent need to provide a quality, comprehensive sexuality education. In the school setting, still the education on this issue is not very sufficient. And we hear from a lot of young people that they don't quite get practical and useful information from the school curriculum. Making sure the young people have voice in the development of policy and programs. And youth participation is a critical component if we really want to take advantage of a population bonus.
What are your views for the efforts of the Vietnamese government in providing the legal framework and how to implement this legal framework for the sexual and reproductive health?
We have to note that so far the population policy have been very much focusing on fertility rate and fertility reduction, birth control, which is a good approach in the past, and that's why Vietnam reached the replacement level fertility rate. The past 10 years we have had around 2.1 fertility rate. But now it is time to really look at the population issues from the broader strategic perspective and making sure that population policies are about socio-economic development of the country. It is not just about fertility rate or health issues. So this kind of a mindset shift is really necessary for the Vietnamese policymakers at this point.
What are the priorities of UNFPA for middle-income country in order to help Vietnam in the next phase of 2016-2020?
We really think we need to have a much more focused and more strategic interventions, given that Vietnam is now a middle-income country, and the role of government will also have to change. If you look at the new direction for the SEDP, we can see that a lot of mentioning of socialization or public service provision. And this means that the government's role will change to create enable environment and set up proper policies and guidelines so that the private sector and including non-governmental organizations will take up a bigger role in the society. So in that context, our role will also need to change, and we will continue to help government to create enable environment for more NGOs and private sector organizations, and also making sure that there is a quality data so that the policymakers can develop evidence-based quality policies and programs.
Thank you so much, Ms. Nhin, for all of your sharing today. Hopefully, UNFPA, in cooperations with the Vietnamese government and the Vietnamese agencies, will help Vietnam to achieve the national strategies 2011-2020. And that's the end for Sharing Vietnam today. Thank you so much for watching us. Hopefully, the show has shared with you on the opportunities and the challenges for Vietnam health system in order to achieve the Millennium Development Goal as well as the national strategies 2011-2020. Any questions and recommendations, please email to sharingvietnam@netvittv.net. Thank you and see you again.